This winter, more than ever, with COVID-19 still circulating, we need help to reduce all avoidable risks. You can help protect the NHS, social care and loved ones by getting the flu vaccine. You may be eligible for the free vaccine at your GP or local pharmacy if you are over 65, pregnant or have a long-term condition. Find out if you are eligible at nhs.uk/staywell. Children up to Year 7 can get the
New restrictions are now in place in Nottingham and Nottinghamshire to help stop the spread of COVID-19. We are now in the high alert level. This means we all have to take extra precautions to keep everyone safe. Being at the high alert level means we must not mix indoors with people from other households. This means no mixing with other households in our homes and in places like pubs and restaurants. We can still meet indoors with people who are in our support bubble. And we can still meet people outside, in parks and gardens, if we follow the rule of 6. We should aim to reduce journeys and walk or cycle wherever possible, or plan ahead to avoid busy times and routes on public transport.
It's vital now that we ask everybody to follow the new measures that have been put in place. It's really important that we do absolutely everything we can to protect the vulnerable and the older people in our population, and also to protect our NHS. We want to avoid a situation where cases of COVID-19 rise and we may need to have further restrictions put in place in our area. We need to continue to follow the guidelines where we are washing our hands, where we are wearing a face covering and where we're keeping our distance. Anybody that does have symptoms of COVID-19, which could be a high temperature, a continuous cough or a loss of taste or smell, must immediately self-isolate and get a test by calling 119.
I want to thank everyone who's doing their part to stop the spread of coronavirus in our towns and communities.
We all have to keep working together to keep people safe in Nottingham and Nottinghamshire.
New restrictions are now in place in Nottingham and Nottinghamshire to help stop the spread of COVID-19. We are now in the high alert level. This means we all have to take extra precautions to keep everyone safe. Being at the high alert level means we must not mix indoors with people from other households. This means no mixing with other households in our homes and in places like pubs and restaurants. We can still meet indoors with people who are in our support bubble. And we can still meet people outside, in parks and gardens, if we follow the rule of 6. We should aim to reduce journeys and walk or cycle wherever possible, or plan ahead to avoid busy times and routes on public transport.
It's vital now that we ask everybody to follow the new measures that have been put in place. It's really important that we do absolutely everything we can to protect the vulnerable and the older people in our population, and also to protect our NHS. We want to avoid a situation where cases of COVID-19 rise and we may need to have further restrictions put in place in our area. We need to continue to follow the guidelines where we are washing our hands, where we are wearing a face covering and where we're keeping our distance. Anybody that does have symptoms of COVID-19, which could be a high temperature, a continuous cough or a loss of taste or smell, must immediately self-isolate and get a test by calling 119.
I want to thank everyone who's doing their part to stop the spread of coronavirus in our towns and communities.
We all have to keep working together to keep people safe in Nottingham and Nottinghamshire.
This winter, more than ever, with COVID-19 still circulating, we need help to reduce all avoidable risks. You can help protect the NHS, social care and loved ones by getting the flu vaccine. You may be eligible for the free vaccine at your GP or local pharmacy if you are over 65, pregnant or have a long-term condition. Find out if you are eligible at nhs.uk/staywell. Children up to Year 7 can get the free nasal spray at school or through their GP if they are below school age. If you are not eligible for the free vaccine, you can pay for it at your local pharmacy. The flu vaccination does not give you flu. It reduces the risk of catching flu, as well as spreading it to others. If you had the vaccination in the past, that will not protect you as the flu strain changes every year, so you need to have a new one this year. It is also important to wash your hands often with warm water and soap. Use tissues when you cough or sneeze, and bin used tissues as quickly as possible. Thank you for helping to protect yourself and loved ones this winter.
New restrictions are now in place in Nottingham and Nottinghamshire to help stop the spread of COVID-19. We are now in the high alert level. This means we all have to take extra precautions to keep everyone safe. Being at the high alert level means we must not mix indoors with people from other households. This means no mixing with other households in our homes and in places like pubs and restaurants. We can still meet indoors with people who are in our support bubble. And we can still meet people outside, in parks and gardens, if we follow the rule of 6. We should aim to reduce journeys and walk or cycle wherever possible, or plan ahead to avoid busy times and routes on public transport.
It's vital now that we ask everybody to follow the new measures that have been put in place. It's really important that we do absolutely everything we can to protect the vulnerable and the older people in our population, and also to protect our NHS. We want to avoid a situation where cases of COVID-19 rise and we may need to have further restrictions put in place in our area. We need to continue to follow the guidelines where we are washing our hands, where we're wearing a face covering and where we're keeping our distance. Anybody that does have symptoms of COVID-19, which could be a high temperature, a continuous cough or a loss of taste or smell, must immediately self-isolate and get a test by calling 119.
I want to thank everyone who's doing their part to stop the spread of coronavirus in our towns and communities.
We all have to keep working together to keep people safe in Nottingham and Nottinghamshire.
Yeah, okay, thank you. Well, good morning, everybody. Welcome to the committee. So for the benefit of viewers of live stream, I'd now ask the clerk of the committee, Sarah Almond, to list the other members and officers present today, please, Sarah.
Thank you, Chairman. So as well as Councillor Knight, the other members present today are Councillors Joyce Bosniak, Councillor Ben Bradley, Councillor Richard Butler, who is substituting for Councillor Reg Adair today, Councillor Mrs Kay Cutts, Councillor Stephen Garner, Councillor Michael Payne, Councillor Alan Rhodes and Councillor Jason Zadrozny. And as well as myself, we also have the following officers present. So we have the Chief Executive Anthony May, Corporate Director Adrian Smith, Director of Public Health Jonathan Gribbin, Service Director Matthew Neal, Service Director Marion Clay, Group Manager Nicola McCoy-Brown and Group Manager Mark Walker. Thank you, Chairman.
Thanks a lot. Well, we'll just go through the preamble first. So the minutes of the last meeting held on the 15th of September. Somebody move those, please. Richard? Oh, okay. Thank you, Stephen. Thank you. Apologies for absence, Sarah.
Thank you, Chairman. So apologies have been received from Councillor Reg Adair due to medical / illness, and as mentioned, Councillor Butler is substituting for him today. Thank you.
Yeah, I don't know if members are aware, but Reg has actually got the COVID virus, so I hope you join with me in giving him our best. I'm not sure how he caught it. He's not sure how he caught it. I mean, he was very run down last week. I did notice when I was speaking to him, and I was just saying to one of the officers, we're at the stage now where there's probably none of us who haven't come into contact with either friends or family or work colleagues who've got the COVID virus. So with your permission, I'll probably phone him and give him his best on behalf of the committee. Okay.
Yeah, please do.
Thank you. Declarations of interest. Has anybody got any declarations of interest? I can't see anybody. No. Okay, thank you. On to COVID-19 situational update, and of course this is a moving feast. What we prepared, the pre-agenda has largely been overtaken by circumstance, but I would like to actually introduce Jonathan to start off the report. Jonathan, if you don't mind, please.
Thank you, Chair. As you say, the report that you've got in front of you, although it's only a few days old, actually looks pretty out of date now. So what I'll do with your agreement, Chair, is to take members through 5 or 6 slides which summarise the current situation. And I'll bring that up on my screen now. Can I check, Chair, can you nod for me that if you can see that?
Yeah, I can see that. Yeah, thank you, John.
So I'm sharing with you then a table of data that a number of you will be quite familiar with now. It lists out by district and borough the all-age incidence rate for COVID-19 for all ages and also for over 60s. And I'm focusing in on some columns over towards the right-hand side of the table. The fourth from the right shows the weekly case rate for all ages, and you'll be able to see there that across all of our districts and boroughs, it's in excess of 300, apart from Newark and Sherwood that I'll comment on in a moment. The column 2 to the right of that is showing the rate amongst over 60s, and you'll be able to see there that it's well up into the 200s across again all of our districts and boroughs, with the exception of Newark and Sherwood. So with the exception of Newark and Sherwood, all of these districts and boroughs remain in what a week or so ago we were still talking about as being tier 3 territory, although of course the situation's moved on now as we face national lockdown in the next couple of days. Newark and Sherwood, which was substantially behind the rest of the county in an unfavourable sense, has caught up, and I think its over 60s rate has already been in tier 3 territory for some time. It breached the 150 per 100,000 mark some time ago, and I think probably later today, with the data that we're likely to have coming through, it'll also breach that for the all age rate as well. The other thing I'll pick out briefly from this table is that if you look over on the right hand side, it shows some percentages which show the changes in the rate in over 60s over the last 7 days or so. And whereas going back a week or two ago, you would have seen, and certainly a couple of weeks ago, you would have seen that rates were going up pretty much across the board at quite a sharp rate. You can probably discern now that in some districts and boroughs, it seems to have leveled off. And that becomes more clear on the next chart, which shows you the over 60s rate for the whole of the county. So this is all the districts and boroughs rolled up together, but just looking at people in districts and boroughs who are over 60. And you can see how from early on in October, the rate was climbing right the way through to around about 23rd, 24th. But in the last 4 or 5 days of data that we've had coming through, we can discern now a flattening off in that in what previously was an increase. And of course, this is a signal which gives us some encouragement, because it's amongst the over 60s. That's the group from amongst which we see people most vulnerable and ending up driving hospitalizations when they become ill and suffer the consequences and complications associated with coronavirus. So I'm wanting to sound a note of encouragement, but I'm afraid I also have to balance that up with a further note of warning. And that really comes out in the next slide that I'll share with you. So I'm going to focus for a moment or two on our local healthcare system. That's not to say that there aren't also some very significant pressures within the care system as well, but focusing on our local NHS, if we compare what's happening now to what we saw at the peak of wave 1, in terms of hospital deaths at the moment, the numbers of hospital deaths are lower than at the peak of wave 1, but I have to tell you that they are still increasing. ITU usage and high dependency unit beds usage is also lower at the moment than at the peak of wave 1, but is increasing. It's lower partly because we've got better treatments now. So people going into hospital needing acute care are getting more effective treatments. So as a proportion, a lower proportion are having to be cared for on ITU. That is a good thing, but that number is still increasing. But of course, those people who no longer need to be cared for on ITU because we've got better treatment still need hospital treatment, and that is what is driving COVID-19 bed occupancy right across all of our hospitals. The data I'm showing you here is for NUH and Sherwood Forest in particular, and as at last week, bed occupancy for those two hospitals was running 40% higher than at the peak of wave 1, which obviously represents a really significant pressure on our hospitals, and of course also in turn then results in further pressure when it comes to discharges as well. Now the chart I'm showing at the bottom relates to admissions, and whereas NHS England are very cagey about allowing their local hospitals to put data like this out into the public domain, this is already in the public domain, and you can see there that on the most recent day for which we had data, which was the 28th of October, there were 67 COVID admissions to Nottingham University hospitals at that point. That represented quite a spike, but throughout last week, on each day of the week, they were admitting a whole ward full of additional COVID-19 patients each day. And that also represents a very considerable strain on the system. Now, the point I need to link this back to for you is that if we're thinking about those admissions on the 28th of October, at the end of last week, you have to look back a week or two further back in time to find the community infection rate, which gave rise to those admission rates at the end of last week. And if we're thinking about the hospital deaths that tragically we saw towards the end of last week, we would have to go back a further week or two back in time beyond that to find the infection rate resulting in those deaths. So if I join that back to this brown line that I've shown you here, which is what's happening to the rate in over 60s, the admission rates at the end of October arose from infections that were acquired just around the time that we were going into tier 2, roughly around the middle of the month. And actually, the hospital deaths that were reported for the end of last week, arose from infections acquired when rates were roughly a quarter of what they are today. So regrettably, although we see some early signals for possible encouragement, I have to advise you that in all likelihood, our hospitals will continue to experience a very high rate of admissions and in all likelihood an increase in the number of deaths over the next few weeks. So we are quite a long way from being through the woods yet. And I need to underline that although it's a potential source of encouragement that we see this brown line flattening off, what we actually need to do is to reverse that trajectory and to get the rates back down lower, because it's not until that they are back down lower that we'll actually see them producing even the level of admissions and the rate of deaths that we're currently observing in our hospitals. And of course, we all want to bring it back in as far as we can to a lower rate than that. So I'll just return and finish up on this table that I showed you to start with, just as a reminder then that really across the county, we have rates at the moment which are driving a number of pressures across our care system and across our healthcare system. And it's absolutely important that we bring these down. Back to you, Chair.
Thank you, Jonathan. I'm going to formally move the recommendation, which is on page 9. Can I have that seconded, please? Seconded, Richard.
Yes, Mr. Chairman, I'm happy to second that recommendation, reserve my right to speak.
Thank you, Richard. And I'm going to open it up for members' questions or comments now. I'm probably going to take a couple at a time if that's okay with members, and then Jonathan, if you can deal with a couple at a time, and then we'll break back. So I've got Joyce, I think, first. Joyce, you're on mute, Joyce.
It's got a mind of its own sometimes. I want to go back to the chart that you last showed us, Jonathan, and you said you were going to mention something about the Newark and Sherwood situation, because that seems to have gone up alarmingly, and I wonder what that's to do with, whether it's a particular incident like at a factory or whatever. So what is that?
Okay, I'll take one more. Is there anybody else, any questions, comments? Jonathan, would you like to answer that one then, please?
Sure. So so Newark and Sherwood has been a bit different, hasn't it, from the rest of the county, and we've seen lower rates there and been pleased to have that situation for a while. The rates have now are following on, unfortunately, behind the rest of the county. I'm not sure. It's not related to any specific setting. This again is about a rise in community transmission generally, and sadly is what I think we were all aware was in all likelihood would happen. It's pretty much impossible to carve out some sort of island where you have just one part of the country, or indeed of our county, that is isolated from the rest, where you can maintain lower rates. When we have this level of transmission going on, it's important that we tackle it right across the county, and I think the situation in Newark and Sherwood is bearing that out at the moment.
Happy with that, Joyce? Okay, thank you, members. So the recommendation you can see on page 9 is that members consider the contents of the report, and I've added "and the presentation," and identify any possible measures to recommend to the Nottinghamshire County Council COVID-19 Engagement Board. We do have to go through reading, taking the vote through Sarah. So to make it clear for everybody, Sarah, you're going to read out the members' names, please. They're alphabetical. If you could just say for, against, or abstain, please.
Thank you, Chairman. So I'll read the members' names in turn, as the Chairman has said. Councillor Bosniak.
For.
Councillor Bradley.
For.
Councillor Butler.
For.
Councillor Cutts. Councillor Cutts.
For.
Thank you. Councillor Garner.
For.
Councillor Knight.
For.
Councillor Payne. Councillor Payne.
For.
Councillor Rhodes.
For.
Councillor Zadrozny.
For.
Thank you. That's unanimously carried.
Okay, thank you. Thank you for that, members. So on to agenda item 5 now, which is the COVID-19 update report. Adrian, are you going to introduce this?
Happily, thank you. So, members, you will have noted that the report here is as out of date as some of the data that Jonathan just referred to, due to the pace of change and the things that have happened since not just when the report was prepared, but indeed when the report was published. So as you can imagine, members, our focus has shifted away from a lot of the things that were referred to in the report that were by and large about services recovering and getting back to normal, to becoming exclusively focused now on I'm hoping you can all hear me, sorry, thank you for that, Sarah. Focusing much more exclusively on planning for not just the restrictions that come into force on Thursday, but any further restrictions that might come our way. So let me just briefly touch on some of the detail and insight into where we're at this point in time, and then I'll hand back to you, Chair, and we can respond to any questions that members might have about specifics. So I want to just firstly touch on the four programmes that are referenced in the paragraph 2 of the report. So once again, at a corporate leadership team level, we've reinstigated these and continuing to now make sure services are prepared for the restrictions to come across each of those programmes around adults, children's, community and economy, whilst also, of course, keeping an eye on corporate resilience. And as members will know, we managed incredibly well during wave 1 of the pandemic earlier in the year to adapt services and introduce new operating models to allow the vast majority of those services to continue, albeit in a different way. In some areas, those operating models have actually continued to run throughout the summer and early part of the autumn-winter period. And those things will therefore continue in those forms throughout the next phase of the restrictions. And in a number of other settings, we'll be introducing further changes, which will in many respects be reminiscent of those that happened in wave 1. We've already started to communicate the impact of some of those changes to our communities. A number of messages were provided yesterday, particularly in relation to our household waste recycling centres, which we expect will continue to remain open throughout the new restrictions that come into force on Thursday. Similarly, our country parks, which again will remain open given the lockdown we're facing later in the week. Outdoor exercise remains something that's actively promoted, albeit some of the indoor facilities in those country parks will have to close. We're awaiting further confirmation around some of our services, further guidance we're anticipating from government, particularly in respect of libraries. But members will be familiar with the click and collect service that we introduced earlier on in the year, and so we'll still be able to, we hope, make access available to book lending services, as well as the other online provision that we've got. The other services that are referred to in paragraph 56, we're currently working through, not only liaising with some of our commissioned service providers, but also partners regionally and nationally to ensure we remain in parallel with some of those national associations, and we'll update members as we take further decisions in terms of service availability across those areas. So I think 2 or 3 final points before I hand back, Chair. In the report pack, we reference work that we were doing at the time to prepare for a further wave of the pandemic lockdown in terms of community support hub. That has now been fully stepped up, and we anticipate that all of the services for our clinically extremely vulnerable population will be in place and go live for Thursday. I think Mark Walker will touch on that a little more in an item later on our agenda. We continue to work with our partners, particularly in district and borough councils, around the business support package, which we hope to provide further detail on in the next day or so. And of course, we continue to work with our local resilience forum partners to ensure that the wider system and support for business and communities holds up well during the new restrictions when they come into force. I'm very conscious that a lot of information is in the report that members might want to comment on, but similarly, colleagues on the call and I would be happy to respond to any questions that members have about things that might have changed.
Thank you, Adrian. I'll open it up for questions and comments in a minute, but I'm just going to formally move the recommendations that are on page 25. Can somebody second that, please?
Yes, Mr. Chairman, happy to second that recommendation and reserve my right to speak.
Thank you, Richard. So I'm opening it up for questions and comments. I've got Jason first. Jason, can't see you.
Count your blessings, John, when you can't see the face.
Big time. Big time.
Thank you, Chairman. Just one of my concerns during this crisis was the lack of tests for NHS and care home staff, and we see it happening again now. And the report says it was a challenge for schools has been in relation to securing tests for members of staff who have become symptomatic. And can we sort of ascertain where that fault lies for that? Is it with the county council or the government? And what can we do to remedy this? As I think we'd argue that we need to be shouting from the hilltops about making sure whoever's responsible can resolve this. And I guess what's the opinion of schools staying open during the national lockdown again? So the report mentions also that the social care sector, COVID-19 support task force, the report on the first phase of COVID-19 pandemic sets out the progress for learning from the first phase in informing advice and recommendations to the government and the social care sector. But the report says that local authorities must put in place their own winter plan. Does that include all of the 7 borough and districts? And the report also proclaims that between March and October that the council handled some 23,200 incoming calls relating to COVID-19. And can I just say that in Ashfield, our own customer service team handled over 31,000 from residents between March and July, and the vast majority of those were related to COVID. So the county council's magic number, which is actually obviously the customer service number, simply couldn't cope. Thousands of residents across the county tried to get in touch, but simply weren't able to be answered. Given that I understand now that that number will be republicised as the main number for people who want to get in touch for any sort of advice or vulnerabilities, what sort of plans have we now put in place for extra services in the customer services team in light of that escalation? Thank you, Mr. Chairman.
Thank you. There's quite a few questions there, but I'll take Ben as well. Then I'll cap it there and then come back to other members. Ben, did you want to ask a question or make a comment as well?
Yeah, thanks, John. So I mean, I'm really pleased that schools are going to stay open. I think the report talks about the increase in kind of mass referrals as we had predicted when they came back again, and obviously, you know, kids being at home and not visible to schools, I think is really quite dangerous in some cases. So, but I guess, are we going to, as we go forward, have a look into those kind of mass referrals and what's coming in now in terms of safeguarding? Because it'd be really interesting to see what the impact of lockdown has been on those kids in particular, and how that affects the service, particularly if we're, you know, God forbid, still in this situation in you know, a month or so's time. That assessment of the impact of lockdown, I think, is hugely important and not something we've necessarily seen. I want to speak up on the point about testing. It says schools, and I've seen myself, schools struggling to access testing. Is that something we can handle locally, or is that just a case of government needing to provide more tests, or is there an answer to that? And finally, around a lot of parents who going back now will probably be feeling very concerned about sending kids back and back to school. I know my own experience yesterday, all of a sudden every parent in the playground's got masks on, and social distancing seems to have appeared in the playground, waiting for drop-off time that didn't exist before. There are clearly you know, slightly different mindset, and there are concerns. So what role does the county have in terms of supporting and facilitating kind of kids being able to be off school, or those kind of agreements? Is that all down to schools and head teachers to manage, or do we have a role in kind of supporting schools to manage that?
Thank you, Ben. I've seen you, Alan, but I'll let the officers answer those first, if you don't mind, and then I'll come back to you. Adrian?
So with your permission, Chair, I'll probably do a bit of orchestration here, because I'm seeing from my colleagues that Anthony would like to talk about customer services I think we have the benefit of Marion Clay on the line, who might be able to talk a little about some of the points, Ben, that you were just touching on there around schools. We can also pick up the point about availability of testing. Just to comment on the winter plan, my understanding is that it's the County Council as the social care authority to put the winter plan in place, and our winter plan for social care is due to go to Adults Committee, I think, later this week. But that's something that we can make available to all members if they'd like to see some of the detail that's contained within the plan. If it's okay, Chair, I'll perhaps look to Anthony to talk about the customer services question, and we'll move on.
Anthony.
Thank you, Chairman. Morning, colleagues. So to Councillor Zatrosny's point about Customer Services Centre, first of all, we're very grateful to District and Borough Council colleagues for the partnership work on the Humanitarian Action Group that's part of the LRF, which has driven our partnership approach to the Coronavirus Community Support Hub, which is the vehicle that we've used to support not just the clinically extremely vulnerable, but anybody with a vulnerability through COVID. The clinically extremely vulnerable, that's a cohort of well over 30,000 across Nottinghamshire, will receive a letter from government today or tomorrow, and Councillor Zatrosny is correct, that will refer them, if they need additional support, to their local authority. And we have arrangements in place at the Customer Services Centre to deal with that. Jason is correct, of course, that the Customer Services Centre has to have sufficient capacity to deal with that. And again, we're grateful to District and Borough Councils for working with us to field customer service enquiries throughout the pandemic. We have put additional staffing into the Customer Services Centre, Jason. We've redeployed people from business support and we've recruited new staff. And we've also approved a budget pressure for additional cash to employ more people in the Customer Services Centre so that we can keep pace. So we will continue to work with District and Borough Council colleagues. Adrian's going to chair a meeting of the Humanitarian Action Group this afternoon to respond to the latest developments for support to the clinically extremely vulnerable, and we continue to monitor capacity at the centre.
Thank you. Marion, did you want to say anything? Is she there? Marion? You've got you're muted, Marion, if you did want to say anything.
Yes, I am. I think Adrian has asked me to answer the questions around parental concern. I think, first of all, to state that the Council does continue to support government policy to keep schools open, and our schools remain open with attendance which is in line or slightly better than national comparisons and with statistical neighbour comparisons. We are aware that some parents as head teachers are concerned and anxious about children attending school, particularly if they're in households where a member of the household is clinically extremely vulnerable or indeed just vulnerable. However, it remains the role of head teachers, and our head teachers are very committed to keeping all children in school. They are making some very difficult decisions, sometimes bespoke decisions around the needs of individual children, but the direction of travel is that children should be in school, and that continues to be the policy. We are encouraging our heads to understand the needs of families, and is particularly when there are perhaps those on chemotherapy and other such treatments in the household or with life-limiting diseases, and our heads are dealing with that in a bespoke and person-centred way. We are seeing better social distancing. We have been encouraging and supporting and advising all schools, all publicly funded schools, to encourage social distancing in the playground when children are being collected, and the lamppost posters have been appreciated by many schools. So the council is continuing to support all publicly funded schools with key messages and with advice which is informed by national and local guidance.
Thank you. Thank you.
Perhaps lastly, Jonathan might want to touch on the point about testing availability.
Yeah, testing availability, Jonathan. Can you just update us on that or inform us?
Yeah, I can do that, Chair. So the system which arranges for bookings to be taken for tests, for the provision of swabs, the infrastructure at test sites where people are going, where people are not having the test at home, the logistics of returning swabs to labs, the processing of the swabs at the labs, and the reporting of results is all something which is nationally commissioned. It's nationally commissioned infrastructure, and as colleagues will, councillors will be aware, if we go back not so many weeks, there was some very considerable pressures, insufficient capacity within the system to meet the demand. Essentially, that was causing problems at a number of levels, and amongst them, I think settings like schools were struggling to get hold of the test that they wanted, that they needed quickly enough. The paper mentions a local process we put in place to at least partially mitigate that. That was a booking process for key workers and their families to ensure that they can get hold of tests that they need. And I should add that as a result of the, or as part of the discussions we were involved with over the last couple of weeks regarding Tier 3, the County Council was awarded some further funding to strengthen what happens around test, trace, isolate, support, enforcement, communications and engagement and so on across the county. And it's something that we'll be returning to make sure that we've got the best possible arrangements in place to support settings like schools right the way through the winter.
Okay, that's good. Alan.
Thanks, Chair. I can actually leave my question till later in the on the agenda. I was going to ask about support to small businesses, but I do notice on this report it says it's covered in a separate item. So I'm assuming that's item 7. I'll ask my question when we get to item 7.
Yeah, thank you. Anybody else on this before I move to the vote? No, Richard, sorry.
Yes, just a quick general query. It's sort of related to the community support hub, but back in March when this wretched thing all kicked off, I think we were all touched and impressed by the swiftness of volunteers, members of the public who garnered literally overnight to set up their own little support groups. I guess until now they've gone a little bit quiet or off the radar on a day-to-day basis from our side of things. But are we seeing, because of the current new wave and the crisis we're in, are we seeing any increase or return of groups, community groups, and so on and so forth, who may be wanting to find out how they can help, type of thing? And if so, what is the best way, or how is the best way to respond to that? Do we just refer them to the general number, etc.? Thanks, Richard.
Yeah,
Adrian, would you like to?
Thank you. Yes, so we were overwhelmed with the excellent wave of support that we had from not just existing organisations in the voluntary and community sector, town and parish councils, but by what we called the spontaneous volunteers, all those new organisations that came forward during wave 1. And we've got all of those sitting in our joint data bank that we share with district and borough partners in the community hub. We've been talking about writing out to all of those organisations again to alert them to what's coming. Anthony mentioned we've got a meeting of our humanitarian assistance group this afternoon where we'll be discussing just that. But importantly, we should also now have an opportunity as well to align that much more in a much more structured way with the Good Sam NHS volunteers that we can kind of bring into our community hub to help communities and individuals through the next phase. So I don't think we've seen a dropping off of numbers, but I do think we'll see some change in the pattern of volunteers, particularly it's winter, it's a different time of year. people's motivation will be different, but I'm firmly of the view we'll have a good network of support there that we can offer people, and we'll write out to voluntary groups soon.
Okay, thank you very much.
Thanks, Richard. Okay, so members will see that the recommendations there are on page 25. There's nothing contentious in the two recommendations, I don't think so. I've moved them, Richard seconded them. Sarah, would you like to read out the names again, please?
Thank you, Chairman. So once again, I'll read the names in turn. Councillor Bosniak.
For.
Councillor Bradley.
For.
Councillor Butler.
For.
Councillor Cutts.
For.
Councillor Garner.
For.
Councillor Knight.
For.
Councillor Payne. Councillor Payne.
For.
Councillor Rhodes.
For.
Councillor Zadrozny.
For.
Thank you. That's unanimously carried.
Thank you very much. So we move on to probably a bit more contentious item now, the food and basic support during the COVID-19 pandemic. So I'm going to ask Mark. Mark, where are you to lead on this?
Hi, Chair. Thank you.
Thank you.
Yeah, so in front of members, you have a fairly detailed report that describes the efforts of the council and partners, both in the public and the community and voluntary sector, to support those in need of food and other basic support during the pandemic. The report does tell a positive story of the new systems and programmes that have been designed and delivered to meet those needs in an often rapidly changing situation. It also outlines what plans we've put in place to ensure that support is there for the winter period, and the preparations we've put in place already regarding the potential new restrictions. A couple of key updates and developments since the report has been written. Jonathan, Adrian and Anthony have obviously referenced some of these, but the first one I just wanted to flag up was with the Emergency Assistance Fund at paragraph 11. We've now awarded 291,000 to 25 projects, and there's 300, just under circa 300k of applications under consideration with partners for the Emergency Assistance Fund. And then the second development, of course, significant one, is the nationwide restrictions that government are proposing to bring in as of Thursday. With that will bring a responsibility on local authorities to support those who are clinically extremely vulnerable and who cannot access food and other basic support themselves. And the government will be providing funding for that work for the 4-week period. It's going to be a different approach to the previous national programme of food box deliveries for the first wave. And as been spoken about a couple of times today, we will be working very closely with local resilience forum partners via the humanitarian assistance group that Adrian chairs, and we have that meeting today where we will look at how we work together to do that. So in summary, I hope the report conveys the preparedness of the authority and partners to deal with those in need going forward, both in the short term, but also in the longer term. Thank you, Chair.
Thank you very much, Mark. So I'm going to formally move the recommendations which are on page 30. Can somebody second those, please?
Yes, Mr. Chairman, I'm happy to second and reserve my rights. Thank you.
Okay, any questions or comments on that agenda item, please, colleagues? No? Good. Oh, Mike.
Yeah, thanks, Chair, and thank you to Adrian, Colin and other colleagues who have provided me with some further information about those applications that are outstanding. Just a specific question, maybe one for Mark or Adrian to pick up outside of the meeting. There's an organisation, Community Kitchen, that are providing meals every day in my division, which has been awarded £10,000 from the fund, which they're really pleased with. Spoke very highly of how the process worked and the support they'd had from county council officers. They've not received the funding yet, though, and they've been waiting quite a few weeks. So they've had confirmation, but the funding just hasn't come through, and they're coming quite close to running out of food as they're getting towards Christmas, and they're obviously sort of getting apprehensive now. They've seen this new announcement about extra lockdown. So if somebody can just check, it's probably just a glitch issue or an error somewhere in the system. But if somebody can chase that up, it's the St Albans Community Kitchen. But they wanted me to pass on their thanks in terms of the way the process has worked and the support that they've had. And certainly the conversations I've had with Kathy Harvey and her team have been very good. And I just hope we can get the rest of that money mark out of the door as soon as possible. I know I've seen the detail that there are applications there. I hope we can get that out as soon as possible. Thank you, Chairman.
Thanks, Mark. We'll chase that up for you. You made a note of that then, Mark, have you?
Yeah, I'll certainly take that one away and chase that. Yeah, make sure where we are.
Can you just get an officer to report back to Michael as well?
Yeah, we will do. Yeah.
Okay, thank you. Jason?
Thank you, Chair. Just on that, on the £1 million coronavirus fund, so the council gave out 695,000 to the 260 applicants, and the fund closed in September. And obviously, I don't think any of us think that failing to give out 305,000 is really a success. So what's the plans to reintroduce this and improve the communication across the county? Because throwing out a few press releases and the odd story on the council website, you know, and a few tweets is not really good enough. So we need to make sure that we're injecting this support really where it's needed. So I think the communication's the big key, and I'm wondering what the plan is for that, Chairman.
Fair enough. Questions? I mean, any suggestions?
Well, I guess most members know where these places are, but so I would just suggest that we email out members, because then at least no members can say they've not been consulted. We all know where, you know, these food banks and local charities are, and I also think that takes the sting out of members being able to say we weren't consulted. So I think that's probably the first thing I would do, Mr. Chairman.
Yeah. Okay. Fair enough. Mark, is there anything you want to add to that?
I mean, certainly something we can take away. I mean, during the whole process of these funds, we've been having weekly meetings with obviously colleagues from all the district councils, all the community and voluntary sector organisations, where we've been you know, communicating directly with them to make sure that the understanding of the availability of this funding is out there. But take on board the point about local elected members.
Yeah. Okay. That's. I think that's quite a constructive agenda item. Sorry. Okay. Kay, beg your pardon.
Thank you, John. Thank you. Yes, I've got my hand up.
So,
if you recall, last time we did contact all members, and we had some difficulty getting any applications in from 2 or 3 districts, and we're very concerned that there were people that were missing out. That whether local members didn't inform us, I don't know. There also is more resilience being built in the community now. I know in my own division where various kitchens have set up to provide meals, and they have received funding both from the forum, from myself, and from their local town and parish councils as well. So I think it's slightly different this way round. But of course, it's not successful spending money when you don't need to. So this is a fund that is a bid fund for people that require it, and no one will be discriminated against. But if you don't require it, it doesn't seem much sense to me in spending public money for the sake of it, which is, of course, a policy I'm sure any of us want to support. So if you do have any areas which you think are deficient, and I'm sorry to hear that Michael's hasn't happened yet, because I remember that one going before the committee. It is one of those things which has really helped the community. And I think Gedling Borough Council actually have helped the community quite a lot, which probably allows why we've had fewer applications from Gedling. So I think by and large it's been really well supported. We've also supported people, of course, with things for resilience in the future, like, for example, laptops and communications where they can talk to people who are in difficulties, and that's been part of the fund. So it hasn't just been food, it's building in resilience as well, which I'm assuming is why now we have fewer applications for this fund, and why in the end it was suspended, because there were no applications. If we need to open it up again, of course we will open it up again. I have no pleasure at all in denying anybody across the county any funding they might need. But I do think the situation has changed as we've built resilience into it. So if people do have applications that are worthwhile, I'm sure we'd all be delighted to hear it. And I'm very happy to send out to all members of the council yet again a message, if you like, saying if you know of anyone who wants this funding, would you please put them in touch with the department, because I think that's a sensible thing to do. Thank you.
Yeah, I think the point is that sometimes there are some particularly deprived communities that don't always know the art of bidding for funding, and they often miss out. And I think that the point that, if I'm reading him correctly, that Jason was making is that we need to ensure that everybody at least knows about the funding in order to apply for it. I'm pretty convinced that we've done as good a job as we could have done, but I take on board that perhaps we need to perhaps involve the districts and the boroughs and some of the charities more to get it out to some of the more deprived communities. Joyce.
Yeah, it's on a similar vein actually, because it's about the broader resilience of the community sector and the voluntary sector rather than just about the food. Because I think that county councillors, local county councillors, I think that's a valuable resource that I think has been untapped currently. Because while we're talking to the districts, we're talking to the district councils, we're not really talking to the county councillors. And we have lots and lots of information about voluntary organisation within the area that we represent. We know which community groups are likely to do things. And I think that that information is not going two ways, if you see what I'm trying to say. Because people ask me for information as well about things that I have to go searching for. And maybe it goes back to what Jason was saying about the communication needs to be improved. But we are a resource that I don't think we're being utilised properly. The one thing I was going to mention is that it's about the information. We know that everything is changing. We're now about to go into full lockdown, but a lot of these community groups are also responsible for community centres who, when they're open, they cover a vast range of activities. And they're coming to me and saying, but which activity can we put on? It was confusing enough when we were talking about going into tier 3. And of course, now it's gone into lockdown. I think that whilst we're in lockdown, it gives us a chance to get our message clearer for when we go back into tier 3 again, about what we can do, what we can't do, how community facilities can be used, and particularly those that are run by the voluntary sector themselves. So let's make use of this particular lockdown, but we do need to communicate more effectively with those voluntary groups. And I know of voluntary groups and organisations I don't think the community hub will be aware of at all. So I think a valuable resource we should be tapping into.
Yeah, fair point, Joyce. Thank you very much. I don't want you to get too depressed about this, Mark. I think I'll echo what Michael has said. I've had groups that have praised the county council's response, and I think overall it's been a very good, a very thought out plan. So congratulations to you and to your team. And if you can just take those criticisms on board, and we'll try and get the scheme out even wider than it is at the moment. But that having been said, I can't see anybody else who's got anything to say. So I am going to ask Sarah to read the names out again for the votes, which are on page 30 for the recommendations. Sarah?
Thank you, Chairman. So again, I'll read members' names in turn. Councillor Bosniak.
4.
Councillor Bradley.
4.
Councillor Butler.
4.
Councillor Cutts.
4.
Councillor Garner.
4.
Councillor Knight.
Yeah, 4.
Councillor Payne.
4.
Councillor Rhodes.
4.
Councillor Zadrozny.
4.
Thank you. That's agreed unanimously.
Okay, thank you very much. And we're on to number 7 now. And I think this is where you've got your question, Alan. It's the update on the economy and progress with the Economic Recovery Action Plan 2020 to 2022. This becomes ever more vital the further we go into the pandemic, I'm afraid. Who's going to lead on this one? Matt, do you want to take this over then, please?
Yeah. Thank you, Chair. So this is a report, members, on the Economic Recovery Action Plan, which you'll remember we brought to the last meeting. Just gives an update on where we are with that. A bit of a continuing theme. We obviously introduced and played into this report a number of the national responses to the pandemic, and that's obviously been overtaken by events at the weekend. So I'll also try to introduce, as we go through this, some of the immediate actions that have come out of some of the work nationally around the economic recovery. Couple of things to highlight in the first element of the report are around the continuing VAT cut to the end of March next year, and also the continuing fund for employment and skills. Some things to point out in terms of what the council and its partners are undertaking and have dealt with over the last month is around bidding for funding in relation to green homes and the Green Homes Grant Local Authority Delivery Scheme to retrofit homes, and we were successful with that. The encouragement of modern methods of construction with some of our housing delivery and some of our property sales being accepted to submit a bid for a decarbonisation funding, and then further work around some of our apprenticeships, our levy work, and also with our growth hub and working with local businesses. You'll also be aware, members, that we've worked with colleagues in Inspire and Via and our companies that work with us around their apprenticeship schemes, and also how they're working with some smaller businesses. The final element of the report talks about a healthy active working fund, which is a European social fund for active inclusion. We're working with our partner organisation Futures to submit a bid for that fund. We hope to be able to get £643,000 approximately from the fund, which will then be matched by ourselves. And the report itself recommends that we bid for this funding, and we continue the bid for this funding. The final thing, just to say in terms of some of the elements of the work that I spoke about, which is the job retention scheme. So and some of the other schemes. So you'll all be aware that the furlough scheme has now been extended during November for this period. So as you know, the job support scheme was due to come into play on the 1st of November, but that's now been the furlough scheme has been extended. In terms of business grants, just to pick up on Councillor Rhodes's point, there's been a significant amount of discussion at a local level, working with the districts around how the local restrictions grants and other grants will be delivered to our smaller businesses. And there is a meeting later on today, which is actually chaired by the Chief Executive of Rushcliffe Council to go through that process and finalise how that will be distributed and the guidance in relation to that. Furthermore, we obviously know that there is also the mortgage holidays as well, and 6-month holidays that will also happen as part of the response. And then furthermore, obviously this is more recent around the self-employment income support scheme, and how that will be increased to 80% of trading profits for November. And this was initiatives announced by the Chancellor. And then the deadline for applications around the bounce back loan scheme have been extended to the end of January. So this is all information that has come out after the initial report has been submitted. I will stop there, members. Thank you.
Okay, so I'm going to ask for questions in a minute. I'm just going to move the recommendations on page 37. Can somebody second those, please?
Yes, Mr. Chairman, happy to second and reserve my right to speak.
Thanks. Alan, have you still got some questions?
Well, yes, Chair. I mean, I'm grateful to Matthew for the comments he's just made. I mean, obviously, there's been a great deal of anxiety and confusion among small businesses, especially in the hospitality sector, and we're all aware of that. It's not just an issue that's affecting our county; it's affecting the whole country. And so, for example, my wife and I went out for a pre-lockdown meal on Saturday night, having listened to the Prime Minister's statement. And we got into a conversation. It was a small restaurant, microbrewery and workshop. We got into a conversation with the restaurant owner. He said, "It's killing us. We thought we were in tier 3. We bought all this stock. We thought we'd be open until Christmas. We're now going to be locked down on Thursday." My question really is that, and I can give you loads of other examples, and others can too. So I'm not going to follow that up. But my question is that, are we confident that the assistance that is available to local businesses is easily accessed, and that the money will flow through quickly, given what we've already heard about Michael's example in Gedling about another matter, are we confident that we've got these systems in place, but they are effective and efficient enough to pay the money and the help out to local small businesses quickly?
Thanks, Alan. Do you want to answer that then, please, Matt?
Yeah, happy to, and then I'll probably hand over to Adrian. So I have been involved, Councillor Rose, in terms of the conversations that have been happening at district level, and it appears from the systems and the things that are being put in place there that that I'm confident that there will be quick assistance given. Adrian, did you want to say some more as well?
Yeah, just to re-emphasise that point, Councillor Rose, I think that the question we can raise with district and borough partners this afternoon, because they'll be the administrating body, not the county council. We are there as a supporter and a part of the wider economic support system, and obviously we are advocating that money is allocated as quickly as possible, also that it's targeted to reach some of the gaps that there are in amongst the 7 or so schemes that national government have provided, and also to make sure it reaches the kind of businesses that might not be eligible for some of that national support, which might include the smallest of micro businesses. It might include people who are renting space within other premises, and there are a number of other potential exemptions. So it won't be in our gift to make that decision, because, as I say, it'll be the district and borough councils that do that, but we can certainly convey your comments to them this afternoon.
Okay, Ben?
Yeah, thank you. Just a very quick one. I appreciate it as a district thing in terms of administration, but do we know, given that the lockdown restrictions and whatever have obviously changed very quickly after we moved into Tier 3, are we still accessing that Tier 3 kind of 23 million support? And as I understand, the frameworks for that were due to reach councils yesterday. Do we know if that happened?
So do you want me to comment on that? So yes, so the business, the element of the financial package that would have come to Nottingham and Nottinghamshire authorities around Tier 3 will be available to us nonetheless, and in fact will now be rolled out to all local authorities across the country as the restrictions come into force on Thursday. And we understand that businesses that will in effect be able to backdate to when the Tier 3 restrictions came into force in Nottinghamshire. So nobody in our patch should be disadvantaged by the slightly different timings there. We do have that government guidance, and it's on that guidance that we're building that local scheme. Again, from a county council perspective, you'd realistically expect us to say it would help to have consistency across the county in relation to those discretionary schemes, so that we don't have businesses one side of a border eligible and one on the other side not. But that's again something that Matt and I will be part of discussing with our partners this afternoon. And so yes, it's not quite the full 23 million, because the business support element of that was more in the region of 16.5 million, but that full fund will be available to businesses in our patch.
Thank you very much. Is there anybody else who'd like to ask anything? I mean, to emphasise Alan's point, I think when I've been speaking to small businesses, regardless of whether they've been hospitality or not, the thing that they don't like above everything else is confusion. What they want is a certainty of approach, and I'm afraid that's probably where we've been slipping up. Having said that, not us personally, not in the county, I think as a country we've been slipping up with this, but having said that, I'm not entirely sure how you would have got around it. But speaking to small businesses, what they want to know is where they are and where they have to go, and there have been too many things which I think have been confusing. Hopefully we'll learn from this. Anybody else going to?
Consistency, Chairman. I'm agreeing with you entirely. Clarity and consistency is that's how they can plan.
Kate?
Yes, last week when we were on the call with all the leaders of the district councils, it was made quite clear to the district council and to ourselves that the funding that was coming to us, we should begin to allocate it as per it was agreed by government, as Alan has already pointed out, on an equal basis. But also, we should also leave some in reserve for those businesses which might not have understood that they have to apply for this fund. And that applies to the very small businesses who, perhaps somebody who's renting a chair, for example, they will be eligible for compensation. And back to when we went into the tier 3, as has already been said. So there's every chance that people should be able to access this funding. That's as it's through the district councils, and they will, all of them, administer the scheme as they think fit, and some at different speeds as well. We really do have to rely upon our district council leaders and their chief executives to make quite sure that there is an even spread across the county. And I hope they're going to really support each other in this, because I know from the last time round, I received some anguished emails from people saying, can you please G up certain district councils? My business desperately needs this money. And of course, once we passed the message on, things did happen. It seems a bit of a shame that, well, we've all learned, haven't we, from the past? And let's hope our past experience is going to stand us in good stead. But unless, if there are any problems, I mean, please come back to the county council. I'm sure we can help anyone sort it out. So no one should be left in any doubt of where they stand on this. Thank you.
Thank you for that, Kay. I think it's probably a good precaution to keep a certain amount in reserve for those experiences that you've just mentioned there. I'm going to, unless somebody else has got anything else to say, I'm going to move the recommendations then, please. So, Sarah, would you like to read out the names again, please?
Thank you, Chairman. So once again, I'll read members' names in turn, starting with Councillor Bosniak.
4.
Councillor Bradley.
4.
Councillor Butler.
4.
Councillor Cutts.
4.
Councillor Garner.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes.
4.
Councillor Zadrozny.
4.
That's agreed unanimously, Chair.
Thank you very much. And we're on to the final agenda item, which is the work programme, which you can see on page 37 to 40 of your agenda there. Anybody got any questions or comments on that? There are some things that I'm going to bring to the next committee. I've got a couple of ideas I want to put forward to members. I don't want to put them out into public at the moment, but I will let you know as we move forward. I think we've got one more before Christmas. Is that correct? Yeah. Okay. So if there is anything that you, because it is a moving feast, if you do find that there's something that you want to put on the agenda, just give us an email and I'll do all I can to get it onto the agenda for you. But with that, I'll call this meeting to a close. Thank you very much for your attendance. Thank you, everybody.
Thank you.
Thank you, Chairman. Bye-bye.